Good morning, everyone. Hello. Welcome to the Singapore Pavilion. For those of you who it's your first time here, this is the only room, I think, in COP where it's appropriate to wear a suit jacket. So you found the room with the fans, some of the air conditioning. Hopefully you're feeling comfortable, feeling ready to hear a little bit about a really exciting venture that we're launching today called the Lancet Med Zero. We'll hear from just a second from Richard Horton from the Lancet about this project to introduce it on a video. My name is Tom. I'm head of Health System Carbon Analytics at the National University of Singapore at the Centre for Sustainable Medicine. We have a really exciting panel of experts from around the world today to talk about carbon accounting in healthcare in particular. We've got some slides. We're going to have a good panel discussion. We've got a website launch that we're really excited to share with you as well. So thank you very much for your time and attention. Without further ado, first I would like to introduce a video from Richard Horton from the Lancet to set out a little bit of the context of what this project is about and what we're launching here today.
Everybody. My name is Richard Horton and I work at the Lancet. As you very well know, the Lancet is good at telling other people what to do, but it's also important that we hold our community to the same standards that we expect of everybody else. And so it is the case with the intersection between sustainability and healthcare, because health has its own carbon footprint and we need to measure it, we need to monitor it, and most importantly, we need to do something about it. And that's the purpose of the Lancet Med Zero, which is an ambitious collaboration between partners in Singapore, Australia, Japan, Thailand, the United States, and the United Kingdom. That's us. And it's led by our friend and our colleague, Professor Nick Watts. I am super excited by this new collaboration. We very much look forward to publishing a report every year about its progress. So let's make sustainable healthcare a reality and not a dream. Thank you.
So we're delighted to be collaborating with an institution like the Lancet on this project. The Lancet has been instrumental in talking about climate change and health, the intersection of those two things, for a number of years. They were really pioneers in the kind of medical and academic field of starting to mainstream this into health academia and health research. So we're incredibly excited to be working with the Lancet on this project. As Richard mentioned, this is a collaboration between the Lancet with partners across the world. So we have HITAP in Thailand, the National Institute for Environmental Studies in Japan, Northeastern University in the United States, the National University of Singapore, and colleagues from the University of Melbourne in Australia as well. And that's just the start. So that's the group of people that are launching this thing today, the collaborative effort that we're bringing together, and we want that to be much more in the future. We really do welcome with open arms collaboration and participation in this project from around the world. But I've talked a little bit about the Lancet Med Zero. We've heard the brand name, but you might want to know what it's about and why we're doing it. So for a little bit of context, I used to work in the National Health Service in England, the NHS, and I was part of the team that was building the model of how do you estimate the emissions of a health system, how do you calculate the emissions of something as big and as complex as the NHS in England. And so you start with the easy stuff. You start with electricity. You start with fuel in ambulances. You then go and look at some of the more niche things like metered dose inhalers, the inhalers that you use for asthma and COPD treatment, some of the volatile anesthetic gases that have extremely high global warming potentials. You start thinking about whether senior leadership are taking international flights to conferences. You start talking about various things, water usage, how you're treating your waste. And then suddenly at some point, you run out of things that you can count. And you ask the next question, which is, okay, well, in a clinical context and for a doctor, what's the next thing that I need to know about carbon so that I can make sustainable decisions within my practice, within a clinical setting? What's the next thing that we need to know if I'm in a procurement team in a hospital thinking about how to make better, more effective, more carbon efficient procurement decisions within a health system? So that's what this project is really all about. It is about an expansion and an explosion in the way that we think about carbon data in healthcare. Data today are available for less than 1% of the 2 million medical-related products used globally. And we're here today to launch something that aims to really, really create a step change in that. If we're going to do that, we need collaboration. We need an approach that balances scale and consistency with quality as well. Those 2 million products cannot be footprinted tomorrow in the same really robust, technical, detailed, analytical, life cycle assessment type of way. That takes probably somewhere between 2 months to 12 months to do a full, detailed life cycle assessment of a given product or service or drug. And if you combine that across those 2 million products that we're talking about, you're potentially talking about something like 330,000 years of analytical capacity. But what we can do and what we are doing is we are making clear, analytical driven decisions that allow us to create proxies, allow people to adjust assumptions about carbon data, allow people to bring in data from peer-reviewed sources, from grey literature, from industry-led reports. And that's why we are making this a new open access global database that is launching today and will be live in early 2026. So it's for people from across the health system that could possibly care about carbon data. It's about clinicians, it's about procurement experts, it's about policy leads in ministries of environment as well, and it's about sustainability professionals that we are starting to see explode in the profession around the world. We've designed it so that it's open access, it's transparent. We want it to be very, very user-friendly. We know that talking to a doctor about Scope 3 Category 11 emissions is impossible. We want people to be thinking about emissions in terms of a scalpel, or in terms of an inhaler, or in terms of a litre of nitrous oxide used in a surgical procedure. And we want this to be up to date. This is going to be something that launches today with the coverage of data that we have that is available. We're going to go very, very broad. And we are going to continually update and improve that platform over time to a point where we have the ambition of getting to close to an 80% coverage of those products within 5 years. It looks a little like this. You can see our website if you scan that QR code at the bottom of the slide. So we have a preview for the site, but what it's going to let you do is go in and search for anything that you could be interested in as a medical professional looking for carbon data within a health system. You can see there are some very specific and very detailed things there that as a non-clinician, as an engineer myself, I don't understand quite what they are, but they're all in there and they're all available. And what does it tell you? Well, it tells you something about the carbon footprint of that individual product or drug or service or electricity consumption that you are using. And importantly, I think, most importantly, this thing here, we have a quality rating. So we know that there are some incredibly well done, well-defined, detailed life cycle assessments driven by some of the people that you'll hear on the panel today that are available, and that we want people to know and understand where something is an extremely high-quality LCA-based assessment, or where it is something that maybe we have a few questions about some of the assumptions, or maybe it's something that's driven more from an expenditure-based global average type of perspective, and we would benefit from further research and further improvement to the data over time. And in addition to that, not only one product or one service, if you are a clinician that's interested, for example, in an entire procedure or an entire patient pathway, we'll give you the ability to build up a series of things that are being used in that procedure or in that pathway to come up with a full overall assessment of the emissions associated with that improvement pathway. This is our website. It's medzerocarbon.com. Please do go and check it out. There's a kind of a shadow version of the site on there, a bit of a preview of what will be available in the very, very near future. We also are really excited today to have a publication, a commentary piece in the Lancet as well, which talks a bit more detail about our motivations for this, why we're doing it, and what our plans are for the future. And I think importantly, and what we're again really excited about is as you heard from Richard, this is not going to be a static thing. It's going to be updated as and when we get data and as and when we can bring it into the system. But also, we are going to have an annual publication in the Lancet as well that sets out a state of play and a state of affairs of what the carbon data world looks like for healthcare, which we're really excited to share as well. And the final thing, and hopefully something that the people in the room today and the people who are watching on the video are able to do is we need help to do this thing. This thing only works with collaboration. It cannot be achieved just by one research center or just by 6 research centers. This needs to be a truly collaborative effort if we are really going to leverage the data and the information that we know is out there and we know that people are working on. And we would love to bring it into one place so that this becomes the place that you go if you're a doctor and you want to know about the greenhouse gas emissions of the drug that you are prescribing or the surgical equipment that you're about to go and purchase. So we have this global consultation. Please do share your thoughts with us. If you have information that you would like to be included in this platform, if you have sources of data that you think are relevant and important and that the world needs to know about, please do share it with us. We would love to have your contributions, and over time, we really are looking to expand this to be something very, very big, to the point, I think, where it is the default place that you go as a clinician, as a medical professional, as a sustainability officer in a health system, or as a sustainability planner within a health ministry to learn more about the carbon impacts of what we are doing in healthcare. And just finally, I've listed them all by name already, but I just would like to pay tribute to our collaborators from across the world in helping us to get to this point where we're able to launch this platform today. This stuff only works, I think, if it is enjoyable and if it's fun and it feels exciting. And these are the types of people who we have really enjoyed working with. We have done this in the spirit of being open and sharing and making a positive change on the climate impacts of healthcare. We know that healthcare is one of the most affected sectors globally from the impacts of climate change, but we also know that we as a community of healthcare practitioners and people who work in healthcare research have a responsibility to drive down our emissions as well. And this is part of the solution, we hope, to delivering net zero healthcare worldwide in the future. I will pause there. We have one more video from Dr. Jessamy, also of the Lancet, and then I will invite a panel up to stage, and we'll hear a bit more of thoughts from people around the community and the different types of users that we might expect to bring in with this platform. So thank you very much for your time.
Hello everybody, my name is Jessamy Bagenal. Until very recently I've been a senior executive editor at The Lancet. It's a real pleasure to mark this new partnership between The Lancet and the Centre for Sustainable Healthcare at the National University of Singapore. And this is part of a larger global collaboration between the Health Intervention and Technology Assessment Programme Foundation of Thailand, the National Institute for Environmental Studies of Japan, Northeastern University in the US, and the University of Melbourne. The healthcare community has become increasingly aware of the need to decarbonise healthcare, but it's hard for many healthcare professionals to know how to take action, and so we see this divergence between ambition and results. This platform is different. It represents real, independent data generation that will drive the evidence we need to make healthcare more sustainable, more equitable, and more resilient. Our thanks to Nick Watts and all our partners for their commitment and vision. We look forward to the work ahead and to the impact this collaboration will deliver. Thank you.
All right. So, first of all, again, congratulations to the Singapore Pavilion for having the only working tech, I think, that I've seen that allows us to get a video presentation up on a screen and running and working. So well done to the guys in the corner. It's really great that we can hear from our colleagues at the Lancet who have been incredibly supportive of this venture. I'd like to please ask you to invite up to the stage our panel today. I'll ask them to come up one by one and invite them by name. First, William Liu, Deputy Director of Energy and Climate Policy at the Ministry of Sustainability and the Environment in Singapore. Have a very brief round of applause, please. Dr. Maria Guevara, who is the International Medical Secretary for Médecins Sans Frontières International. Professor Jackie Peel, who's the Director of Melbourne Climate Futures at the University of Melbourne in Australia. And finally, Julien Puil, Team Lead for Climate and Health at UNITAID in France. So thank you very much to our panel. And I think what's exciting today is that we have a really diverse range of people who might be interested in using this kind of data. So we have government, we have clinical expertise and delivery and humanitarian aid, we have research, and we have environmental law and implementation, and then we have LCA expertise and practitioners here as well. So we have, thankfully, the full gamut of the type of people who we are hoping to reach with this type of data. So first, maybe I'll ask them each individually to just go through and for 2 minutes, please, one by one, introduce yourselves and a little bit about your background and how you came to be involved in the climate change or in the healthcare space. Julien.
Hi everyone, thanks for having us. Very excited about this panel and this Net Zero initiative. I'd like to congratulate you guys for putting this out there. Maybe a few words about myself. So my name is Julien Puil. I'm a team lead climate and earth at UNITAID. To set the scene a bit about what we do at UNITAID, UNITAID is a grant-making organization that works on accelerating access to product innovation. We work on product development all the way through market introduction. We do have a climate and health strategy that centers on making and advancing health products that are also climate smart. So eventually we want to have products not just are safe, effective and affordable, but also that are with low footprints. As part of our climate and health strategy, we've been doing quite extensive research, LCA-based research. We published a number of reports. So today I'll try to give you some learnings and some findings from our research.
Thanks, Tom, for the invitation to be here. I'm not a healthcare person. I'm an environmental lawyer. I work particularly on holding countries and also corporations and industry accountable for the climate pledges and their own carbon emissions. And of course, the kind of exercise you're involved in here around data provision and information is the first step towards accountability. At the University of Melbourne, I've been the inaugural director of our Melbourne Climate Futures initiative, which is an interdisciplinary initiative to bring together different disciplines working in the climate space. And it's great to see an interdisciplinary panel here, because I think this kinds of questions about how we best reduce the carbon footprint of different sectors is something that needs an interdisciplinary perspective. So delighted to be here.
Hello, everyone. I'm Dr. Maria Guevara, and I hail from the U.S. in Alabama, but I've not actually lived in the U.S. for the last 20 years because I've been working with Doctors Without Borders. So I'm pulmonary and critical care doc by trade, but now I'm more in the policy spaces, so it's great to be surrounded by experts. I'm currently the International Medical Secretary for MSF International, where I'm also one of the big climate change activists in the heart of MSF, and we've been working on this policy on climate change and environmental degradation since the last decade. We're already behind the 8 ball, but we're really trying to show that you can do this in low resource settings, especially as we know the most affected are in those vulnerable vulnerable settings. And so I think it's really our responsibility to ensure that we can do this, and we can do this together. So I'm glad to be here, and thank you for the invitation.
Okay, hi everyone. I'm William Liu. I'm Deputy Director for Climate Mitigation at the Ministry of Sustainability and Environment in Singapore. So essentially, I'm overseeing climate mitigation policy for the entire nation. Essentially, we have a net zero by 2050 target to to bring our national emissions down to a net zero, it's ambitious. It's going to be difficult, but we try our best. And among other things, we also do work on our Singapore Green Plan, which really lays out our targets, sustainability targets up to 2030, and includes energy efficiency and bringing down emissions, of which includes the healthcare sector, so both our private and public hospitals. So I'm not a healthcare expert in any way, but I maybe can weigh in a little bit on how emissions and how, really in Singapore, how do we bring that sector on board with the rest of the whole of nation movement to really meet our net zero target.
Thank you very much. And then maybe a follow-up to that introduction then. Why do you think it's important that the health sector takes ownership of its own decarbonisation? And how can a platform like the Lancet Med Zero support Singapore's broader national climate priorities? And do you have any examples of healthcare actually already delivering on the green plan in Singapore, as you've referenced?
So the way the green plan is structured, everyone has to pull their part, and everyone has to do it on their own. I mean, the government is taking the lead and does a lot of things, but it's really everyone pulling together, contributing to this wider goal. So in Singapore's context, so we have that 2050 net zero target. So I'll speak more about the public sector. We have a Green Government Singapore movement where the government's actually taking the lead to actually bring our emissions down first. So 2050 is for the whole nation. The government says 2045. We will do it first. We will show the way for all the other sectors. And that includes our public healthcare sector. So our hospitals, also our primary care facilities. And in that, actually, they've done really good work. I have some figures here. I think from 2018 to 2024, our hospitals, primary care facilities, emergency facilities, they've brought their efficiency, energy efficiency, that means the amount of energy used per unit of output, down by between 2 to 5%, even seeing increasing patient load of up to 20%. That's really impressive. They've taken on additional load, but have really taken the effort to really drill down. Where can we bring down our emissions? I think, for example, they've done some work on using anesthetic inhalant gases that are much lower global warming potential, like 20 times less, so that when you use it, you're just emitting less emissions that will actually cause harm. And really looking to things like building codes. I think new healthcare facilities in Singapore, from now onwards, all of them will be subject to super low energy efficiency standards. So these buildings, they have air conditioning for clinical, medical purposes, but they will at the same time be sustainable to meet both the clinical, medical needs as well as our sustainability targets. So I think just a brief summary so far of what I understand, how our healthcare sector is really pushing ahead on this.
Thank you very much. And then maybe a question for both Jackie and Julian to answer together if you can. We've tried very hard to make this independent, open access, free to use, and separate from just direct industry reports. Why do you think it's important that independent academic research institutions like the people on the screen today and like Unitaid have a role to play in the publication and derivation of carbon emissions data?
I'm happy to take that start. Well, with any of these data initiatives, information and transparency really around emissions, the more independent the data, the more we can place trust in the information that's being delivered. So it's really important for research institutions to be involved in collaborative projects to produce this kind of data. There are issues which we may encounter if we're relying solely on industry data. That said, I think reporting on a lot of this sort of carbon footprinting information is very new for the industry, particularly in the healthcare sector. And so there may be needing to be a balance with some level of support back to industry, capacity building, information about how to report, to build the capacity to deliver that data, but the independent assessment of it, the open access nature of the database, I think is really important for building trust and transparency.
Thanks for the question. Maybe I'll elaborate a bit on our thinking and our journey, basically. As a product-driven organization, I think one of the first questions we asked ourselves was around the climate problem of our products. So Unitaid is supporting life-saving product for LMICs, and we wanted really to understand what was the extent of the problem of those products. So that's when eventually we started working on LCA, And here, what we wanted to do very quickly is to be able to identify the hotspots, be able to double-click on each and every product, identify within the value chain, across geographies, and even at supplier level as to what can be done about that. So for us, running LCA was kind of almost a natural step towards it. It wasn't easy. We had to hire specialized consultant to support us. It's eventually pretty technical. We've looked into different products, including medicines, and as you all know, active pharmaceutical ingredient of medicine can be a challenging process to understand from a climate perspective. So we built also a panel of experts to help us navigate through the complexity of running LCA and make sure eventually at the back end the results were quality assured. For us, running LCA was also not, I would say, an end in itself. The second challenge or second question we wanted to front load from the outset is that actually once we have the LCA results, what do we do with that? What do we do about it? I mean, and for us, it's obvious actually an LCA is aimed at achieving or advancing at least decarbonization. And I want to give you maybe a few numbers here, just to draw some very practical example of the work. We've looked into one particular product that is called the HIV, the dolutegravir. It's an HIV regimen that is currently taken by 24 million patients globally. Using the ACA approach, we've been able to identify where the emissions coming from. And unsurprisingly, 85% of emissions using this LCA were proven to come from the active pharmaceutical ingredients. So we're able to even do one step further. We're able to identify that 75% of those emissions are just hinging on 5 manufacturers in India and China. So again, LCA was really a way for us to double click to the point where actually we're able to identify, where the emissions for. And we've been able to bring this one step further, identifying what could be done about it. So we engage manufacturers, we engage 20 manufacturers to understand, what could be done about it, understand decarbonization feasibility, but also the readiness of actors and the readiness of the market to start advancing the decarbonization. So again, LCA was a very practical entry point for us to understand what could be done about it. And we've come out also with interesting findings from that study, be able to demonstrate that actually more than 40% of the product emissions, so again, this HIV first-line regimen that could be abated at zero cost to patients. So that type of finding was very illuminating to us. And again, the LCA work was a very important entry point again to entertain even a dialogue with manufacturers.
Thank you, and that certainly chimed with my experience of working on health system emissions accounting, is that yes, you can have average factors that take you so far, but it is the LCA data, it is the detail that tells you about, okay, well, how do you go about actually reducing the emissions impact of some of your system? Dr. Maria, I might ask you a question and request that you answer it with 2 different hats on. So one as a clinician, and 2 as a leader of a large organization with a very big procurement role in medication. What kind of decisions, what kind of improvements in delivery of care can this type of information provide you, both at the level of a clinician, but also at the level of an organization?
Yeah, great. That's almost like saying cradle to the grave question, and this is why life cycle assessment approaches are important. But maybe first to say that I think as a collective of in MSF, we consider our responsibility. We are guided by medical ethics, first of all, and humanitarian principles, and we really take to heart the do no harm elements, the non-maleficence as an ethical value. And so when we started to look at climate change and environmental degradation, we really tried to integrate, firstly, our mitigation and our practices before we looked into adaptation, which is a lot more investment. And then how do we speak to that from evidence-based? So it's great to be sitting here again because we've worked with UnitAid, with operational research in academia also, and of course, dependent on policies of a country. And what we've committed to as MSF is the climate charter for humanitarian action and the humanitarian organizations to decrease our carbon footprint by half compared to by 2030 compared to 2019. And of course, that's nearly impossible to do because at the end of the day, we want to make sure that our access is still there and we will obviously always have a bottom line. We also first preserve quality of care. So as a physician who's actually taking care of a patient, we want to make sure that we are providing the best quality service we can in some of the low resource settings that we have. in the larger scale as an institution, I can just give you some examples. Dr. Horton said, you know, Lancet tells you what to do, but we also work with Lancet in collaboration to see what we can do, and not so much to dictate, but to show what is possible. And one of the things that we've published with the Lancet Countdown tracking progress of health and climate change, we always give a brief of what our experiences, and one of those is on plastics, single-use plastics, which is critical. Because as you know, a lot of the plastics that we use today is in the healthcare facility is massive. So if you look at the 1950s of 1.5 million tons of plastic being used, today it's 2023, it's like 400 million tons. And at least half of those are related to single use. And the healthcare facility is one of the biggest users of that single use. In MSF, we have 15,000 articles in our supply chain, and at least 6,000 of those are plastics, and at least 2/3 are single use. And so we've done a study of our list, and we've drilled that down to about 160 products to try, because of the volume that we use. And now we're looking at 20, and the majority of that is the gloves and also infusion sets. The problem with the PVCs that are making up a lot of these plastics is it leaks the toxic additives of, it's diethyl ethyl phthalate, DHP, it actually can cause neuroendocrine changes in the body, so fetal growth retardation or behavioral problems. So we want to really look at that. So one of the things we're trying to do now is phase out PVC infused materials, which is hard. The problem is there are not many alternatives. So we do look at other actors to try to push the advocacy for that, because we need to have access to alternative products, and this is part of why we're here, is to call for that. So data is available that this Lancet Net Zero can do is show what those products are, what is available, and also promote advocacy to do more research and development. So we're really looking forward to such a platform.
Thank you so much. And then a reflection that I've had is it's been hugely encouraging to see an explosion in the number of people within healthcare systems who are working on sustainability in the last certainly 5 years. It feels really, really transformational, the number of people who are thinking about this and caring about this. And it feels like healthcare no longer claims an exemption from responsibility on climate change, which I personally think is incredibly positive, because then you have a network of trusted medical professionals who are driving this thing forward. But as a result, the healthcare sector on decarbonisation probably is also slightly behind some of the other sectors in terms of its maturity on emissions measurement and its ability to account for carbon. So maybe a question for the two non-medical experts on the panel. What are some things that we as a healthcare community could learn from other different sectors of the economy and bring into healthcare to help us do sustainability more effectively and more efficiently? William.
Maybe I'll go first. So I guess I know a little bit of what's going on in the healthcare sector, but I'm more familiar with our approach in Singapore with other sectors, how we have gone them along on the transition journey. And I think important thing is to give it a bit of time, to lay out goals and ideas clearly, and then you solely socialize. So I'll give you an example. We announced as a nation our carbon tax in 2022. We said we were going to start slow and we're going to slowly ramp it up. That was a lot of lag time, a long lead time in a sense, you know. And obviously, initially, companies are coming to us like, "What's going on? My costs are going to increase. Everything is going to go to the end of the world," you know. But over time, actually, initially, after the initial furor, we see companies coming and saying, "We want to help. We really want to be involved as well. We do see it impacting our business, our bottom line. We see that actually we need to change the way we do things. How do we do it then?" And then actually as a government, what we do is that we provide support. We educate further. we provide capacity building. We walk along the same journey. We don't just slap policy and say, you got to follow, and there's no question about it. So I think that's an important lesson, I guess, at a broader healthcare sector level or even at an institution level, that it takes a bit of time, but trust people. I mean, from my personal reflection, it's not exactly my job, but I have colleagues dealing with adaptation, heat stress. I'm sure clinicians, and especially in tropical Singapore and Brazil and other countries, they're seeing increasing levels of heat stroke, heat injury arising from climate change. They're seeing the palpable impacts of climate change affecting their clinical daily practice. They probably see the problem itself. And just give it time and people will realize we need to come together and figure out how in my daily work can I actually make the change to stop this feedback cycle. So I guess just my little sharing on how I think the healthcare sector can go ahead.
Yeah, I think my greatest familiarity is with reducing emissions in the energy sector, which obviously is a major contributor to emissions through fossil fuel use. And probably the major learning from that is very similar to what William is saying, that when these sorts of measures are being initially introduced, it's not something that can be just leapfrogged to mandatory regulation, targets, responsibilities straight away. There is a need to bring people along on the journey, why you're doing this, what the responsibility of the sector is, what capacity and support there is to enable this kind of change, because it is a transformational change within sectors like the healthcare sector to think about emissions and to balance that with some of the concerns that are more traditionally a consideration, like patient care and making sure that you're delivering good medical service.
That's great, thank you. And then the other thing that we think about a lot as we're developing these types of platforms is uncertainty and navigating the things that we don't know, but making effective and efficient decisions as we run through that. So, Julian, maybe a question for you, which I'll then open up to the rest of the panel, is how do we know what good enough looks like from a data point of view, and how do you know when something is of sufficient quality to make a decision and make an active step to actually change something for the better within a health system?
Thanks for the question. No, that's a very interesting question. Maybe 3 elements of response. I'm not sure I have all the answers, but at least the way we look at it in the day, for sure, we need solid, quality assured information for SCA. No doubt. There's no way for us to move to action with data that's not been again, quality assured in some way. Of course, in the space we're in, behind product emissions, there are also commercial stakes. So we want to make sure also we're able to verify independently, especially claims from manufacturers from that perspective. But it's probably my second point. I think also we need to recognize that actually depending on the use cases and the context, sometimes we don't need perfect data. We start scoping and trying to understand the order of magnitude of the problem. Rough cuts are perfectly acceptable. And I think that's why we've gone about it at the beginning with our work, trying to really understand what are the big climate problems before be able to delve into things in more detail. And maybe the third point, my response is back to the relationship or, with manufacturers and these potential risks associated to greenwashing and how do you go about it. Based on our experience, to be honest, we've been a bit surprised to engage with especially the generic manufacturing industry. So we engaged with 20 manufacturers, and the first feedback we got from them is actually they don't really know how to go about product emission calculation. So what we found out is actually beyond the greenwashing or the perceived risk that is around greenwashing is actually the real technical capacity issues. So one of the solutions we are exploring currently is mechanisms to, let's say, overcome this important pitfall, basically, and try to support technical assistance to manufacturers who are not necessarily big pharmas. We know that actually the generic industry plays an important role, and the volumes of medicines that are coming from this industry are huge, and we shouldn't be working with the assumption that actually the technical knowledge is there. So we need to anticipate also ways in which basically we can have manufacturers part of the equation and not just them sitting on the problem side of things.
Anyone else want to add anything to that question about what good enough looks like to make a decision to go and make an intervention for the better?
I think it's important to understand that climate change is about living with uncertainty, and there's also the overlay of urgency. We are dealing with an existential threat. We know that there's a very short window to reduce emissions. So it is a question, a balance between perfection in the data, but also good enough to allow us to make sensible decisions about how to reduce emissions. I think one of the other issues about data is that we don't have standardised procedures for reporting on a lot of this kind of new emissions data, particularly Scope 3 emissions. So essentially downstream emissions or emissions that are in your supply chain. I think you mentioned that for your organisation you might be looking at something like 15,000 suppliers. So how you get your Scope 3 emissions are essentially their direct emissions. Getting that kind of data about how much emissions are produced by all of those different suppliers, breaking it down in terms of the ones that have the most impact is part of the challenge here. So I think capacity building has been mentioned several times, working with manufacturers. It is that kind of longer journey, but also with this overlay of we've got to get on with the job.
If you don't mind, I think from MSF's perspective, I think it's the fact that we are at the field level, we can actually do the research together with the community, and they are the ones who are actually where the data should be coming from. So empowering that capacity to do that and partnering, but also looking at, because science is imperfect, as we know, looking at it, trends is important because it's really more about how you're using the same data, how it actually is making an impact, and so that's critical. And I think that we have to be able to also triangulate. And what's most important for us is also protecting the community, because today with innovation and AI, machine learning, I think it's also about the ethical use of that data that we also need to look at. So it's as much the accuracy as well as the confidentiality and protection that should be looking into.
Maybe I'll just add a small thing. Actually, for our national data collection, we've learned that you got to start somewhere. And as you go along, things get better and improves, and then you actually can refine yourself. And I think for healthcare institutions, it's a matter of looking at what you already have. For example, Scope 2 emissions. That's your power bill, basically. Look at your power bill and then put an emission factor, get a rough estimate first, and refine it over time. You need information on your life cycle cost of your materials. You do inventory, you do collection of that. There's just a starting point. You don't have to get it perfect the first time.
Thanks so much, everyone. And I think that capacity building and skill development thing is really, really important. And I'm at risk of doing something that no moderator should ever do, which is to insult most of the panel, including myself. But the type of people who have been doing carbon calculations and understand what Scope 3 emissions are and know how to do an LCA are generally quite weird. And that's part of what we're trying to do with this platform, is we're trying to make it accessible to a doctor who doesn't have a day a week or a day a month to think about sustainability, but maybe has 10 minutes where they want to go and check something quickly and are interested in the health impacts. And that might then transform into okay, well, I can make an improvement here, or I can go and integrate this into my clinical practice. So we really are interested in not just targeting the weirdos like me and my esteemed colleagues on the panel, but actually the people who are doing medical practice day to day and just want something easy and readily available and easy to understand on climate data as well. I think your point in general on building capacity within industry, within healthcare systems as well is really important. The other thing that we're very well aware of as we launch this platform is that the rate of change of technology and methodology within this field is rapidly improving, and we're very, very interested in looking at things like machine learning, things like automation, things like bringing in heuristic approaches to thinking about carbon data, but doing that in a way that it is, again, still transparent, accessible, trustworthy. I wondered if you might comment on some of the trends that you see coming in this field and what might change over the next 5-10 years that allow us to have better and more widespread carbon data.
Good question. No, I think there's a point around AI. I think there are lots of use cases around AI, and I think this is a good case, basically, to use AI to mainstream use of LCA. And we've been in touch with different partners, basically, who are developing solutions and be able to, through one question under ChatGPT, be able to learn what's going to carbon footprint of a particular product in a very solid manner is clearly a kind of a next frontier. So that eventually we're able to all together wear some carbon glasses, where it's like start to look at the carbon emissions. I would say that another, I don't know if it's a frontier to say, or another area where research needs to delve deeper into is decarbonization, and especially decarbonization at zero cost to patients. At Unite, we care a lot for access, and from that perspective, be able to make sure decarbonization is not fear as something that would be disrupting supply or raising cost is really an area where actually research on decarbonization levers, strategies to overcome some of the barriers is critical. And I would lastly say basically there's probably another frontier, and we speak a lot about mitigation today. So it's clear that actually health products do have safety profile, do have efficacy profile, they could have a carbon profile, but we need to think about also the adaptation here. We need to think about some some particular issues that climate change will be imposing on some product, and we are at Unite, we're working on heat stability of health products. So to some extent, heat stability of health product, which is an adaptation topic, could also at some point lend a given product profile to be able to make the right decision, you know, that are low carbon, but also to some extent also conducive of climate resilience.
And we're starting to get towards the end of the session. So I think another part of the way that we're approaching this and the collaboration and the bringing in different perspectives and different experiences, it allows you to learn so much more by bringing in different professions, different types of expertise into one place and having some kind of a shared understanding of how to deliver decarbonization within healthcare. I wondered if everyone, and don't feel like you need to provide a world-changing answer, but what's one surprising thing on decarbonization that you've learnt within your field that you would like everyone else in the room to know about? What's the important thing that you picked up on that you think needs to be shared with the wider group in that view of collaboration? Maria, you look like you have an immediate answer, so I'll go to you first.
I'll start with, from a clinician's perspective, I think we need to find a balance between patient safety and decarbonization. You know, for MSF, as I've said, we have been looking a lot at our mitigation and how we reduce the impact of our practices and ensure sustainable healthcare practice. And, you know, when we look at the reduce, reuse, recycle, and it's a lot on reduction, right? It's reducing the intensity of the equipment that we use. You know, you were mentioning about heat. When your oxygen tanks are melting and you can't treat throes of pediatric patients, it's really a matter of life and death. And so we really need to push that. And we know that in some of the countries we work in, even just to the waste management aspect and the high level emissions, incineration that you need is not always existing, and that should just be made available. But it's also about reducing, it's stewardship, right? So from the clinician's perspective or the practitioner perspective and an organization, we need to be better at forecasting, we need to better rational use of this, because at the end of the day, that efficiency also leads to effective care and how we make it timely and make it more accessible. But it's always about quality assured products. And that exists, but we just need to have more visibility on the mandate the materials disclosures of some of these products, and that we were going to rely on experts to push for.
Still thinking?
Well, I was thinking really hard, actually, and it's not going to be talking about the medical field, what I share. But I think with every challenge comes opportunity, and in my time working in this field, I've seen a lot of very enterprising, brilliant, passionate people come up with amazing opportunities and turning this climate crisis and challenge into something really good, bringing people together. I mean, the sort of solutions out there for decarbonization, I remember I went for postgraduate studies a little bit, and got a sense of how, on the climate technology space, how some companies are breaking new grounds on battery storage, you know, instead of just thinking about batteries as lithium ion, chemical batteries and everything, using gravity, using heat, using waste heat. You know, all these innovations, they're really, really remarkable. And I'm not that familiar with the healthcare sector, but I believe there's huge potential. There are brilliant, passionate, dedicated people in the healthcare sector who can turn this challenge and this crisis into opportunity to really reform, not just improving the outcome for the world in terms of the emissions and mitigation, but also for patients and communities involved.
I was just reflecting that, as I said, most of the work that I do on decarbonisation is in the energy sector, where we're dealing with fossil fuel industries. That's really hard work. And a lot of what the negotiations are going on around you is focused on how we might have fossil fuel phase out. That's being very much resisted by the industry sector. I think healthcare offers a really different environment and a great opportunity, as William said. It is the caring profession, and I think there is much more of an orientation from healthcare providers, from doctors, to try and embrace their social responsibility to be reducing emissions and playing their part in addressing climate change. So I think it's a really positive environment for decarbonisation. I'm sort of thinking maybe I need to switch away from energy into health, get more joy. Thanks.
Yeah, come and join us.
One of the surprise we unveil through our study is actually how much carbon footprint of health products are invisible. The product I was mentioning, so this first-line HIV regimen, at market scale, it's 2.6 megatons of CO2. It's the annual emission of a city like Geneva a year. It's just one product. So for us, it's very striking, actually. When we think about carbon emission, we think about fossil fuel, we think about heavy industry, we think about aviation. We don't think about the healthcare industry so much. And I think there's a stark paradox, because many of those products are also life-saving products. So here we need to find a way to address that paradox, be able to provide product that offers protection, health protection, but also planet protection.
All some very good examples from the panel there. I think I'd like to just close the discussion today. First of all, by thanking each of you very, very much for your contribution today. We really do appreciate it, and it's been really valuable to me to hear from your experiences and your different perspectives. The thing I love about this space is that no one goes into healthcare sustainability as a healthcare sustainability expert. You get doctors, you get sustainability experts, you get public health people, you get engineers, researchers, academics. And I think this is a reflection, the launch of this Med Zero, we have all of those people involved in the creation of this platform. And I really love that about this space. I love the fact that you can go and speak to an engineer and a public health expert and a doctor and a pediatrician and a whoever, and they all care about the same thing, and they're all trying to deliver the thing, but bringing in very widely different, varying perspectives into the solution of decarbonising healthcare. Please do, for those of you in the room and who are watching, please do go check out medzerocarbon.com. Go and read our commentary piece in the Lancet. Respond to our consultation. We would love to hear from you about what you might be able to bring and what your advice is and your knowledge and expertise is on how to bring carbon data into healthcare as well. Thank you on behalf of the Sustainable Medicine Centre for Sustainable Medicine as well at NUS, to colleagues at the SG Pavilion for hosting us. Been an incredibly smooth and polished pavilion event experience so far. So to everyone here, thank you very much for your time and attention. Thank you to our panelists. Thank you to SG Pavilion, and have a great rest of your COP.